The World Health Organization has declared the coronavirus a global pandemic. The agency says it's deeply concerned by the spread and severity of the illness and by the alarming levels of inaction. Europe correspondent Samantha Hawley reports.
This evening they have said that they are moving this virus from epidemic stage to pandemic. Now, they have held off doing that, of course, in recent weeks, but the head of the WHO says that action now needs to be taken because of the rapid increase and the severity of the cases around the world. Now, let's hear from the WHO chief, Tedros Ghebreyesus.
Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death.
Legally, it doesn't change anything, and of course it doesn't change anything in terms of the virus itself. There was already a global emergency in place, so nations were already working together, but I think it really will focus the minds of nations like Australia, like the United Kingdom, for instance, about how they now approach this going forward, whether they or not, for instance, they move into that delay phase, which would be shutting down schools, getting people to work from home. But the WHO, I think, has been cautious moving into this next phase because, of course, it can cause panic. We saw the last pandemic in 2009 for the H1N1 flu, the swine flu. That was a pandemic, and we did see at that time widespread panic when it was declared a pandemic. So I think that's why for some time now the WHO has tried to avoid moving to a pandemic, and today it has really called for people to remain calm, but it has said, as you heard there, that it is a necessary step now to take, given in the past 2 weeks outside of China, there's been a 13-fold increase in the number of cases. In Italy, for instance, just today, in the last 24 hours at least, there's been a 200 increase in the number of deaths, so a very rapid increase there in the number of people dying from this virus.
Samantha Hawley reporting there. Now, Professor William Rawlinson is a senior medical virologist with New South Wales Health, and he joins us now. William Rawlinson, welcome. So first of all, we've had this declaration by the World Health Organization overnight of this pandemic. What is a pandemic?
A pandemic is a general term. It really just means that the infection is on multiple countries, so every continent is involved, and it's increasingly a preparedness term, if you like. It's really saying we need to be prepared for more person-to-person spread. It's an enhancing term. It's not necessarily like a great shift. It's enhancing preparedness, it's enhancing emergency preparedness, those kind of things.
Do you believe the WHO has got the timing on this about right, or do you believe it should have moved earlier?
Look, it's a difficult question. I think that the main thing is preparedness. Australia, of course, declared a pandemic in February, on the 27th of February. The term is really just one that says prepare your emergency departments, prepare your diagnostic services, prepare your therapeutics. And so I think the WHO has considered it very carefully. Globally, of course, there's been difference between countries, and countries have had different levels of preparedness. This says everybody should be preparing for person-to-person spread. So
how bad could this get in Australia?
It's the almost impossible question. The evidence so far is that quarantining and a number of control measures have actually worked very well, because we think that this COVID-19 is spread particularly by close contact, and that's why things like the cruise ship spread was so dramatic. That's why in countries where it's winter, countries where there's a lot of people, where they're close. So we think that a lot of the measures that Australia's put in place, quarantining, incubation periods about 2 weeks, so having people who are at risk, keeping them self-quarantining for 2 weeks, it does appear to have made a lot of difference. It's still a risk of spread, of course, but we are testing a lot more, and we are diagnosing more because of that, and that means therefore people can prevent that spread.
So are you optimistic the spread can be minimised to an extent in Australia, and that over the next 12 months we won't have the situation where this virus sweeps through more than half of the community? Because that's what we want to avoid, isn't it? Because there is no vaccine. Older people are really vulnerable. If it sweeps through the older population, it would be a terrible situation.
It's a very good point. What we are trying to avoid is things like nursing home spread, elderly spread, because they're the people who are getting the more severe disease and pneumonia and they're dying. I think we've already seen some effects of the public health measures that have been put in place. I do think we've seen reduction in spread, and I think what that drives in my mind is that we need to continue those measures. We need to diagnose people, and people need to be well informed. They need to get good information from the internet, from the WHO, CDC, the health department websites, and they need to do those kind of things. My optimism is based upon the fact that I see that it's been reduced. And if you look at Herb A, for example, where a lot of things were introduced, then that epidemic curve has come down.
But you have a very different government system in China where they can take pretty drastic measures. Do you think the Australian population should allow for that here in Australia? If we want to particularly protect our elderly people, our parents and grandparents, we should be thinking about, should we expect that we could see some pretty drastic measures here in Australia, and that those measures are necessary if we want to protect those people?
That's a government policy, public health decision, and I think that's measured based upon how things progress. But if you look at influenza as a sort of parallel model, a lot of differences, but if you look at the model, during pandemic flu, a lot of people did appropriate things. They got tested, they took antivirals, they were vaccinated. We hope for a vaccine for this, but it won't be, as you say, for a while, probably a year or two at least. And so those kind of things happened during 2009 in the pandemic, and they did make a difference. And remember, the vulnerable people then were pregnant women, they were the elderly and the very young.
And so in New South Wales, we just heard a media conference from Gladys Berejiklian earlier this morning. So 77 cases in New South Wales, a bit of a jump overnight in the number of cases, 12. And the concern is that it's unclear what the source for a number of those people was. How concerned are you about that developing?
Look, we obviously monitor it very closely, and you have to be concerned when you see increases. We are testing many more people. So in New South Wales Health Pathology, the number of tests we're doing has tripled. So you would expect that you would diagnose more people, and that's why you do it, of course. You hope that you don't see people increasing in numbers, but you do it because you can diagnose people, then they can quarantine, then their family can be quarantined or do what's appropriate, whatever's appropriate. So I'm actually not surprised. I think that what I hope for is a levelling out of that, but we'll see over the coming week in particular.
And William, tell us about your role. You've got a lab, and so what's your involvement in trying to keep a lid on this?
So in New South Wales Health, there's a range of people from public health and clearly all the way through to people who run fever clinics, infection control. My role is a medical virologist. There's a couple of medical virologists in each state. I oversee a laboratory for New South Wales Health Pathology, which works closely with emergency local services. We're at Prince of Wales, so we clearly have a lot of work with Sydney Children's, with Prince of Wales, with the Royal Hospital Women. There's a similarly large lab at Westmead who have a role out there, and then we provide a reference service, and what's happening is that the tests that have been developed overseas, we develop here. They're then rolled out to other public health laboratories who often have very large populations. That's happened now, so Liverpool Hospital's testing, North Shore's starting to test over the next few days. So, and the private laboratories have a very important role as well. They're starting to introduce tests, and of course so do commercial producers. So our role is to look at commercial tests now, because the ones we've had have been developed in our research setting, and we look at those commercial tests, we assess them, we provide quality assurance, which means that if you get a result, you know that it's correct. That's ultimately that's the most important question. So that's just been rolled out. That's come back yesterday, so we're analysing those data. And over the next week or so, we look at those tests, you look at rolling them out, and then you hand them over, and other laboratories can do just what we're doing at the moment, but in larger numbers.
Well, you're going to be a very busy man over the next 12 months or so. Thanks so much for coming in and having a chat to us, and good luck with your work over the coming year.
Thank you very much.